Welcome to the training for healthcare professionals. Let's begin with the module on intradermal injections. Before we begin, let's look at the key learning objectives. After completing this module, you will be able to describe what an intradermal injection is, identify when an intradermal injection should be given, and demonstrate the procedure to administer an intradermal injection. First, let us understand the structure of human skin. Skin is the largest sense organ of the human body. Skin protects, secretes, excretes, and regulates body temperature. There are 3 primary layers of skin. Click each label for more information on the structure of the skin. Epidermis. The topmost layer, it protects against water loss, injury, and prevents entry of germs into the body. Dermis, the mid-layer. It contains nerves, blood vessels, sweat glands, and hair follicles. Subcutaneous, the bottommost layer. It contains tissues that insulate and cushion the skin. What are intradermal injections? Intradermal injections are injections given to a patient into the dermal layer of the skin, just under the epidermis. These are injected at approximately a 10 to 15 degree angle. They are administered usually into the forearm. Other sites include the upper chest, the upper arm, and shoulder blades as shown. When do we use intradermal injections? Intradermal injections are used to conduct skin allergy tests and to test for antibody formation. They're also used to inject potent medicines requiring a slower absorption. Since the dermis has a reduced blood supply, the medication absorption from here is slower, thereby reducing the risk of an adverse reaction. Click the medicine box to see the items needed for an intradermal injection administration. We need items such as alcohol swabs, syringe, needle with size 25 to 27 gauge, half to 5/8 of an inch, disposable gloves, medication as prescribed. Now let us see the procedure to give intradermal injection step by step. Click each image for more information. 1. Check the doctor's order. 2. Check the rights of medication. 3. Check the medicine for discoloration and impurities. 4. Calculate the right dose. 5. Select correct needle size and syringe, that is, it should be 25 to 27 gauge, half to 5/8 of an inch. After you have prepared your equipment, you should do the following. Wash your hands and wear gloves. Check the patient's wrist identification label for inpatient details. Explain procedure to patient or parent. Maintain patient privacy at all times. Position the patient upright. Now you should do the following. Click each step for more information. 1. Select the site, the forearm, the upper chest, the upper arm, or shoulder blades. 2. Rub injection site with an alcohol swab and allow it to air dry. 3. Use another alcohol swab to clean the stopper of the medicine ampule or bottle. 4. Attach the correct size needle to the syringe. 5. Draw the prescribed amount of medicine by pulling the plunger, then remove air bubbles from the syringe by pushing the plunger, and the required amount of medicine will be drawn into the syringe. 6. With bevel up, completely insert bevel into patient's skin at a 10 to 15 degree angle. 7. Inject medication, then withdraw the needle gently and place a cotton ball over the site. Sometimes a slight swelling may appear at the site. 8. Dispose of the needle into the sharps box. 9. Dispose the gloves in the appropriate bin and wash your hands. 10. Document the patient details and patient's response.
Okay. Good afternoon, Rosie. My name is Shannon. I'm here to give you a PPD test today. May I verify your last name and date of birth?
Traversy, 11/30/68.
Thank you, Rosie. As you know, this is a test for your employment admission for your great new job, and I need to have you come back in 2 days to read the results. I could see you either on Wednesday or Thursday.
Let's go Thursday.
All right. So we do this test on your forearm. Do you have an arm preference?
How about this one?
That arm is perfect. So I'm just going to take a moment to cleanse the site. I'm selecting a site that's away from major blood vessels, so away from these blood vessels and away from these blood vessels. Somewhere right here on the flat side of your arm is perfect. I'm going to cleanse that site in concentric circles, starting in the center, working outward, never crossing the same area. For my supplies, I need a pair of gloves, my syringe, and a cotton ball. No Band-Aid is necessary for this injection. After I've wiped the site with alcohol, I'm going to apply my gloves. The reason I did the alcohol first is to give it a chance to dry during the glove application. Now, the way I prefer to do this is I'm going to come in at this angle using a one-handed technique. The most important aspect of this injection is angle, as little angle as possible. I'm going to hold the skin nice and tight using my non-dominant hand. With the bevel up, the bevel has to be up at all times. I'm going to place the bevel just under the surface of the skin. Do you see how you can almost see the needle under the skin there?
Yes.
That's going to allow us, as I inject the medication, to be able to form a wheel. As this wheel forms, it's depositing the PPD medication into the skin layers so that it has a chance to react. When all the medication has been deposited, you're going to pull straight out using the same angle of insertion. You can release the tightness of the skin. Using the same hand you had the needle in, holding the needle downward, I want you to hold the green ring and the flanges and pull until you hear the click. That needle has to go directly into the sharps container. Now, Rosie, I noticed that you're not bleeding at all, but it's very common at the actual injection site for a small drop of blood to form. And it's appropriate to take the cotton swab and just, with a feather-like touch, just swipe in case there's a drop of blood there. You're not bleeding at all, so I wouldn't have had to do that. But it's very common for there to have been a drop of blood there. I would always recommend to my patient to just, leave the site alone. Please don't push on it to disperse the medication. We want the medication to settle just as it is. And this is the area we'll check when you come back in 2 to 3 days.
Perfect. Thank you so much.
Thank you. So if you would remove your arm, cleanup for this skill is just to remove your tidy towel and all your supplies and your gloves.
Always remember to complete your documentation after the procedure is done. Now let's summarize some essential points to remember. Click each image for more information. Make sure patient is in a comfortable position. Cross-check the volume of medicine drawn up against the physician's order and calculation to ensure that the correct amount is administered. Check to see if the tip of the needle is visible directly beneath the surface of the skin. Resistance should be felt when medication is injected.